I am delighted to be here today, and thank you for that very warm welcome. I've just arrived from New Zealand and Australia, literally, so I'm not sure which hemisphere I am in. But I must remember to tell you when I get to some specifics about what the Australians are doing about cigarette smoking. It's quite interesting, and I would like to see us do something here in the United States as well, so I'll be sure and come back to that. It's one of my fondest hopes that one day that people like you will give people like me a bit more free time. Done correctly, public health has the capacity to decrease the incidence of a variety of illnesses, from diabetes to lung cancer to HIV/AIDS. Done properly, it can free physicians to spend more time helping patients stay healthy and be more effective with those who are ill. The question remains, how do we do it? Many people believe that evidence-based practice in both public health and medicine is the answer. I'm here to speak to you today about evidence-based practice, what we've learned from it, our concerns about it, and how we can work with public health professionals to make sure it all works for the good of our patients and populations. Above all, we have been asked and tasked to accomplish the triple aim: improve the experience of health care, improve the health of populations, and reduce the per capita costs of health care. It's a daunting task, but we've done as much before, and we can surely do this. Since 1900, the average lifespan has picked up 30 years. We can attribute about 25 of those to public health advances. Without partnerships between public health and medicine, we may have never beaten back many diseases to the extent we have to date. And to name a few, and you're very aware of these: polio, German measles, HIV/AIDS, West Nile, SARS, and many, many more. But first, some proof that the AMA has been working with and for public health all along. AMA leaders helped form the American Public Health Association in 1872. AMA members have long been instrumental in forming state boards of health and health departments. In 1996, members of the American Medical Association and the APHA convened the Medicine and Public Health Initiative. This initiative was largely spearheaded by the late Dr. Ron Davis, a dear friend to all of us in this room, and this was aimed at integrating public health practice with clinical medicine. What a great legacy that was left, not only in this arena by Ron, but in many others. In 2004, the AMA co-hosted with the Centers for Disease Control the first National Preparedness Congress. In supporting the 2010 health reform law, which, by the way, was not easy for some, the AMA also supports the Patient-Centered Outcomes Research Institute, which will sponsor comparative effectiveness research. If you only knew how many hours I have spent trying to explain to people what comparative effectiveness research will not do. The AMA's Council on Science and Public Health regularly provides science-based information and recommendations on medical, scientific, and public health issues. These reports have spanned a wide range of topics, and they have included hormone replacement therapy, AIDS and HIV, sustainable foods, medicinal marijuana, and many, many more. The AMA has a memorandum of understanding with the CDC to improve understanding, awareness, and collaboration between medicine and public health. The MOU is being expanded now beyond public health to include quality, aging, pharmacogenomics, and disaster preparedness. We also have in Don Ziegler, a liaison to the CDC Community Preventive Services Task Force. He is our Director of Prevention and Healthy Lifestyles at the AMA. Some of the AMA's public health accomplishments and efforts include tobacco cessation. Now, Ron Davis, as you all know, was the 162nd president of the AMA and a 2008 recipient of the APHA Lifetime Achievement Award. Before his death in 2008, Dr. Davis worked tirelessly for anti-tobacco initiatives. He was director of the Centers for Disease Control's Office on Smoking and health and director at the Center for Health Promotion and Disease Prevention for the Henry Ford Health System in Detroit. He was founding editor of Tobacco Control, an international journal known for its engaging style and scientific rigor. He wrote hundreds of peer-reviewed articles that influenced public perception of tobacco. It is physicians like Dr. Davis who inspire us to do our best to protect the public we serve. Now let me tell you about Australia. I never saw so much smoking in my life. Everywhere, young men, young women, old women. But in fact, it turns out the other AMA, the Australian Medical Association, has been on a very strong pathway to work towards tobacco cessation in the country of Australia. And one morning, we had a visit by the Minister of Health for Australia. Well, I didn't know what it was. We weren't told what the subject was. But since the World Medical Association was meeting in Sydney, and that's why I was there, the health minister was invited to address the World Medical Association our council. And about the time she arrived, I never saw so many press people in my life, because what we didn't know was that she was about to make a very large announcement, and it had not been leaked to the press ahead of time. And what they are going to do and legislate in Australia, that cigarette packs now have to become generic. They don't have pretty labels or pretty pictures or cool things on the front of them to make people want to smoke and make them be buyable in a store. They're going to be the ugliest olive, green, drab paper packages you have ever seen in your life. They've done a study and determined this was the most nauseating color they could come up with. And then on top of that, the warnings are going to include some really rather nasty pictures, and one of which I found particularly inviting was someone with really bad, crummy teeth. Oh, bad gum lines, rotten teeth. I mean, you know, some young girl looking at that picture on an ugly, drab, olive brown packaging, surely to goodness would put down that pack of cigarettes and walk away. The other one was a young child on a respirator because of lung disease from secondhand smoke. So the World Medical Association was the benefit of hearing that for the first time, and I would like nothing more for this state, but particularly this country, to take on something like this. Now, someone said to me, how likely is that to happen in the United States? And I said, you know, right now, probably not really good. But you know something? This is something this country could handle, and we should think about doing it and start at least talking about it. It would scare the you-know-what out of some people, and it's high time that we were willing to take on and be as aggressive as the Australians have in getting this sort of thing accomplished. The WMA put out a policy paper that the AMA wrote, basically, which delineates multiple steps and multiple issues around smoking, smokeless tobacco, and all sorts of things, and we'll be putting out a policy paper on electronic cigarettes in the not-too-distant future as well. So we're very much engaged in this process. That was my Australia story. I was really impressed by this. Some of the people there were kind of turned off by the pictures, but you know, a picture can say a lot of things in a very short period of time.